And that's really the two main ones we see. With the open enrollment, I will say that even if you are on a marketplace plan and you're happy with the plan, new plan offerings are available every open enrollment. So it is something I would say is important to review, even if you're happy with your current situation, just to see if any new plans may fit better.
Welcome back. Again, we're excited to have our thought leadership here from Zach Cole today. Zach is going to be helping us to unpack how to think about health insurance options when maybe that employer is not offering what we need, or if we're in a life transition. So we're going to be talking about COBRA, about marketplace plans and individual health insurance today. And again, Zach is part of that team that is a non-commissioned health insurance agents, and basically they set aside any conflict of interest, work with our clients to be able to find that best healthcare solution. And we've been working with Zach and his team for many years now. And so Zach, thanks for coming on today with us.
Yeah, happy to be here.
So as we dive in, let's just say we're in one of those circumstances. Either we lose employment, so we've got some different options ahead of us, or maybe our employer doesn't offer health insurance. As we dive in, let's talk a little bit about COBRA first. Can you unpack a bit of what COBRA is and who that applies to?
COBRA is going to be the continuation of coverage that you currently have through your employer-sponsored plan. Any eligible employee it's going to be anyone that has recently lost that coverage. Either they've been terminated by their employer or if they're leaving that employment. That is a federally mandated, it is a law that it has to be offered for up to 18 months. In certain situations, it can be extended to 36 months, but most typically it's going to fall into that 18-month window. Main things to know with COBRA is that the employer does not have to pay for subsidizing the premium any longer. So typically you'll see COBRA be the full premium cost of the plan with a 2% additional administrative fee on top of that. So that's going to be the first thing to note there. But with the plan itself, it's going to be the same exact benefits being offered as the plan you're currently on. So your deductible and out-of-pocket max numbers are going to be exactly the same. And then furthermore, let's say that you lose that employer coverage mid-year, your deductible and out-of-pocket max numbers will roll over with you from being on the employer plan to COBRA. So that is a big factor to look at when determining if COBRA is the route you would like to go. Secondly is going to be the network you're part of is going to be exactly the same. So if you do have a set network, everyone accepts your current plan, they'll accept the COBRA plan as well. So really it is just a pure mirror of the plan you're on. The biggest difference is going to be the premium is going to rise and then also have that 2% administrative fee on top of that as well.
So if we like our current plan and we're willing to pay more for it, then COBRA might be the path that is best there in some circumstances, it sounds like.
Yes, especially if you had already met your deductible and out-of-pocket max numbers for the year. That is going to play a huge factor instead of restarting that mid-year through a marketplace or individual plan.
So Zach, you mentioned some of the holding periods or the waiting periods that people have to experience. So let's assume we have someone that's leaving the workforce voluntarily. They've got a new job and they know that there might be a period of time, let's say 60 days, where they are uninsured. What should a client do in that circumstance?
Yeah, so in that situation, that's something where I would work with the client to see if they have any upcoming visits, doctors, any appointments, procedures coming up during that time. And then we would mainly compare looking at a marketplace plan. So you can voluntarily drop a marketplace plan at any time. So we would be looking at that 60-day window to enroll in a marketplace plan just to have coverage in place. And then also looking at the short-term plans where it may have a little bit cheaper premium on that front. And really that's just protecting against any major incidents that may occur during that time. So any major hospital visits. I would say really it'd be working with the client to ensure that they have coverage that they need during that time.
So as we pivot and we talk about the marketplace plans, let's just say we've gotten to the end of our COBRA period and we're not with an employer that either offers coverage or maybe we still are out of work there. What can you unpack what the marketplace plans are and kind of the basics there?
The marketplace is going to be pretty much the exchange for all the health insurance plans based on your zip code and county. The biggest thing to note there is it's broken into a metal tier system. So you have a bronze level plan, silver level plan, gold, and platinum level plan. So your bronze level plan is going to be your most baseline coverage for the cheapest premium. And then as you go up each plan, your premium is going to rise, but your benefits are going to be better. So typically, it depends on age, tobacco use, how many people are on the plan, so on and so forth, are really going to determine what that premium is going to look like with each tier. And I always say to take a look at each tier, kind of see where your coverage, what kind of level of coverage you want, and then go from there.
So is everybody eligible for Marketplace, or is this only a certain subset of people?
Yep. So everyone's going to be eligible for a Marketplace plan as long as they live in the U.S. and they are a U.S. citizen. That's going to be the two biggest criteria. And then offerings do change depending on your area. So even in the state of Tennessee, a plan in Nashville may be offered, where in Knoxville it may not be offered. So it is dependent on the area you're in as well.
And then, so we've got the marketplace plans, and a lot of those, have really just come about, in the last 10 years or so, or were they set up, was it legislation that was 2011 sometime in there that pushed things through? How do those relate to, say, the individual plans? What's the differences there, and how should we think about individual health insurance plans?
The biggest thing is going to be the Affordable Care Act.
Okay.
All the plans on the marketplace are going to be Affordable Care Act compliant, meaning that they can't ask about any pre-existing conditions, where on the individual side, where if you're buying straight from a carrier, they can have some pre-existing condition exclusions. Furthermore, is looking at those tax credits that can be applied to the marketplace plans, where many times on the individual side, you will not have the benefit of those tax credits depending on the company you're going with.
Okay. So let's talk about those tax credits. Does that make some of those marketplace plans more affordable? It seems like the marketplace plans, there's some level of maybe subsidization based on income. Is that right?
That is correct. So it's going to be based on, first off, how many people are on the plan. So if it's individual or if it's a family. And then secondly, they're going to be looking at your adjusted gross income for the year. It's based on the federal poverty line. So if you fall between 100 to 400% of the federal poverty line, that is when you'll fall into the range to receive a tax credit, which will reduce that monthly premium. The biggest thing to note on that is whenever you initially enroll into a marketplace plan, it's asking for more of an estimate on what you expect to earn for the year of 2023. And then whenever you file your taxes at the end of the year, they'll take that adjusted gross income to the marketplace and determine, based on what your final number was, how much of that tax credit either needs to be paid back, or if you get it back on your return as well.
And this is one of those fun things that sometimes we've had an opportunity with you and your team to kind of work through. How much income do we really want a client to have if they retire, say, prior to 65, and we're looking at them having a marketplace plan, because the Roth distributions, they're not going to have the same taxable income, the impact to the adjusted gross income they're not going to have, for instance, that a distribution from an IRA might have, or harvesting long-term capital gains might have. One of the things that your team has really helped us with over time has been looking at those subsidies and making sure that we understand the moving parts with how much income we really need to target, in certain scenarios. A side note there, but appreciate you and your team's help on that. So we talked about offerings, varying by state. And really even within the state, Knoxville to Nashville even being different. Anything else that we should know about, say, marketplace plans or individual plans? Are there certain scenarios where you say, okay, you could go marketplace, but individual is actually going to be far better for you?
There are some certain situations that would apply to that, especially on maybe a short-term plan where we're just trying to bridge a gap to get a different type of coverage. Let's say you're starting a new job in 2 months, don't want a marketplace plan at that time. You just need something to bridge the gap for that 2-month period. There are short-term term plans available that can help with that as well.
In terms of enrollment in these different plans, are there certain windows that we need to be aware of in terms of when you could enroll, or maybe when you could change, a marketplace plan?
Qualifying event is going to be one of the first ones that we mainly see. That's going to be anytime looking at marriage, divorce, moving out of state, having a child, so on and so forth. So with a qualifying event, you have 60 days to enroll into a marketplace plan from the time of the event. And then outside of that window, we're really looking at open enrollment each year as the primary time to look at plans and make changes. That's going to be October through December for a January 1st effective date. Some states vary on stretch it out to January 15th for a February 1st effective date. So that is dependent on the state as well. And that's really the two main ones we see. With the open enrollment, I will say that even if you are on a marketplace plan and you're happy with the plan, new plan offerings are available every open enrollment. So it is something I would say is important to review, even if you're happy with your current situation, just to see if any new plans may fit better.
If you think about this entire space, plans that are offered not by the employer and not through Medicare, any additional guidance that you'd make in terms of a mistake that you might see people making, or maybe things that they don't understand?
Networks is going to be one of the primary factors with the marketplace. I'll use Blue Cross Blue Shield as an example here, where they have an S network and a P network, where your provider may be in network with the Blue Cross S network, but not in network with the P network. So it is important to make sure before enrolling into a plan that all your providers you see on a regular basis are going to be covered under and in network with that policy.
Well, thanks again for joining us today and giving us insight on COBRA, the individual plans, the marketplace plans, and things that we just need to be considering as we help clients understand the framework and how they make choices there.
Yeah, definitely. Thanks for having me.
If you like these financial planning videos, please share it with a friend, and if you have questions, go to our website at SiriusRetirement.com. This content was provided by Retirement Planning Services. We are located in Knoxville, Tennessee. You can visit our website at SiriusRetirement.com. The information in this recording is intended for general educational and informational purposes only, and should not be construed as investment advisory, financial planning, legal, tax, or other professional advice based on your specific situation. Please consult with your professional advisor before taking any action based on its contents. Advisory services offered through Retirement Planning Services, LLC.